we have mostly concentrated up to now on monogenetic abnormalities that relate and cause Parkinson's disease. Meanwhile, in addition, we have also learned that multiple polymorphisms may also be important to understand why some people develop Parkinson's syndrome and others don't. But the later science is really brand new, and there is not any sound information so far available. But I think it has become extremely important and fruitful that we have learned so much about monogenetic derived Parkinson's syndromes. If you look at me, you know, and you can see that I worked for many, many decades in Parkinson's syndrome. And at the beginning, when we learned about the first monogenetic abnormalities, I thought, well, that's for specialists, maybe like me, but not for the community. This has changed a lot because I think the most important development was the finding that an abnormality in the gene that is responsible for the protein alpha-synuclein may cause Parkinson's syndrome. This was the so-called Controversies family and described in maybe now 24 years ago. And then we have learned there is a protein which is called alpha-synuclein. If this protein is not functioning well, this may cause Parkinson's syndrome. From there, people have analyzed alpha-synuclein, and we have learned by now that this is the most important abnormal protein related to all people, almost all, with Parkinson's syndrome. So genetics has opened our eyes that we may in the future concentrate even on therapies that prohibit the accumulation of alpha-synuclein. A second example why it is so important that we have learned about these genetic defects is the occurrence of very young Parkinsonian patients. My youngest patient, for instance, is 16 years old. And if I would have met him, let's say 30 years ago, I would have said there's something wrong. Either I make a misdiagnosis or this person is really special. Now, by now we know that this early occurrence of Parkinson's syndrome is very often related to certain genetic abnormalities. And this helps a lot because in former times, the young people with Parkinsonian syndromes, they did not get a real diagnosis. And this leads to uncertainty. This leads to problems, mental problems, also mood problems. And it is, of course, not a nice diagnosis to learn that you suffer from Parkinson's syndrome, but you know that we have excellent medication available. And so I think that derived from this genetic analysis, this is extremely helpful to the patients. In addition, we have, and this is also a more recent finding, found out that even in countries where we don't have large families suffering from a PD syndrome, we do have many patients that are a little bit different from the regular PD patient. And these are patients now in the 50s and that don't respond so well to dopamine replacement therapy and have pretty early cognitive problems. Now we have learned that such patients may suffer from a glucocerebroside gene defect. And this again helps us to understand better why we have so many different categories, also from the clinical picture in Parkinson's syndrome. And I do think that this ultimately or in the future will lead to adequate treatment.